In case of medical emergencies, I think most of our staffs are BLS trained, and all the BSc nursing staffs are ACLS trained. So they are well experienced in handling emergencies. First, when they find an unresponsive client, everybody having a knowledge to see one by one, step by step, looking for the respiration, call for the nurses for help. At the same time, they'll be ready to call for an ambulance also. If the respiration is proper and the pulse is felt, then they immediately looking for CBG, that's a capillary blood glucose level, to find out whether they are hypoglycemic. If it has been found the blood sugar is very less, for example, like 40, 50, less than 70 is called hypoglycemic, they immediately rush in 25% dextrose, 25 ml. They are all being trained in such a way that they can give immediately, and if their blood sugar level is corrected, the patient becomes conscious. In case if blood pressure is very low, they immediately start normal saline cushion, a bolus of normal saline 100 ml, and thereby the patient becomes responsive. And these things can be tackled in our setup in an organization. All our nurses have been trained. And if they're not responding to that, immediately they will start doing an CPR. CPR is given, and if it is not, they are responding, immediately they call for an ambulance and mobilize them to the hospital setup. Otherwise, if patient complains of chest pain, then they will look in for associated symptoms. For example, if the client is complaining of chest pain and discomfort and difficult in breathing, we always ask them leading questions like, is the pain radiating to the jaw, radiating to the left upper arm, and is there any numbness in the fingers, or if they have palpitation and sweating is there, profuse sweating, like that. And what is the type of chest pain, whether it is pressing type, and we wanted to know the intensity of that. This is more important is they should know the history. All our nurses here know the history of all the clients. So if they always, if they have a previous history of cardiac and previous cardiac surgery, CAPG, stenting, anything has been done, then immediately we think of a cardiac cause. Okay. Now, if there is any associated symptoms for a chest pain patient, we do an ECG and find out whether there is a infarct is there. And if the ECG confirms there is a myocardial infarction, we shift them to the hospital. And this is how we tackle it. We always, when they give a noise, we have a call bell system, and if the call bell is rung, people keep rushing into the room so that they have many people to help them. It is not a single-handed. In a case of emergency, they handle it.